Hi, in this video we will talk about that do this. No kidney patient will ever lose a kidney again. These small but mighty organs play a crucial role in filtering waste and excess fluids from our blood, maintaining electrolyte balance, and regulating blood pressure. It implies a sense of assurance and confidence in the methods, strategies, or information being presented to prevent kidney loss or damage. This could encompass various aspects of kidney health, including prevention measures, treatments, lifestyle changes, or advancements in medical technology aimed at preserving kidney function and minimizing the need for kidney removal or transplantation. It implies a sense of certainty and confidence in the methods, treatments, or strategies being presented to prevent kidney loss or damage. Overall, it communicates a message of hope and assurance for individuals dealing with kidney issues, promising a future where kidney loss is no longer a concern. Number 1. Dietary. While protein is essential for overall health, excessive consumption can strain the kidneys. Aim for a balanced intake of high-quality proteins from sources like lean meats, fish, eggs, dairy, and plant-based sources like legumes and tofu. Too much salt in your diet can raise blood pressure and put extra stress on your kidneys. Be mindful of sodium in processed foods, canned goods, and restaurant meals. Opt for fresh, whole foods whenever possible and season dishes with herbs and spices instead of salt. Number 2. Root cause. Emphasizing preventive measures such as regular health screenings, blood pressure monitoring, and diabetes management can help detect kidney issues early on and prevent them from progressing to a point where kidney loss becomes a risk. Providing comprehensive education and support to kidney patients, including information about their condition, treatment options, and self-management strategies, can empower them to take an active role in their care and make informed decisions to preserve kidney function. Number 3. Regular exercise. Regular exercise helps maintain healthy blood pressure and cholesterol levels, reducing the risk of cardiovascular disease. Since high blood pressure is a leading cause of kidney damage, managing cardiovascular health through exercise can indirectly protect kidney function. Exercise helps regulate blood sugar levels and improves insulin sensitivity, reducing the risk of diabetes-related kidney damage. By promoting better glycemic control, regular physical activity can mitigate the risk of kidney loss in diabetic patients. Number 4. Blood sugar level. Diabetes is one of the leading causes of kidney disease, known as diabetic nephropathy. High blood sugar levels over time can damage the small blood vessels in the kidneys, leading to decreased kidney function and, in severe cases, kidney failure. Glomeruli are the tiny filters in the kidneys responsible for filtering waste products from the blood. High blood sugar levels can cause damage to the glomeruli, leading to proteinuria, the presence of protein in the urine, and progressive kidney damage. Number 5. Stress. Chronic stress can trigger the body's fight-or-flight response, leading to increased secretion of stress hormones like cortisol and adrenaline. These hormones can elevate blood pressure and heart rate, placing additional strain on the kidneys. By practicing stress management, deep breathing, and meditation can help prevent the harmful effects of chronic stress on kidney function. Dealing with a chronic illness like kidney disease can be emotionally challenging and stressful. Learning effective coping strategies, such as mindfulness, cognitive behavioral therapy, and support groups, can help individuals navigate the emotional and psychological aspects of their condition, reducing stress levels and promoting overall well-being. Number 6. Sleep. Adequate sleep plays a vital role in regulating blood pressure, which is essential for maintaining healthy kidney function. Chronic sleep deprivation has been linked to hypertension, high blood pressure, a leading cause of kidney disease. By getting enough sleep, individuals can help keep their blood pressure within a healthy range, reducing the risk of kidney damage. Quality sleep is necessary for proper immune function. Poor sleep can weaken the immune system, making individuals more susceptible to infections and inflammatory conditions that can harm the kidneys. By prioritizing restorative sleep, individuals can bolster their immune defenses and protect against kidney damage. Number 7. Oxalates. Oxalate is a substance found in many foods that can bind with calcium in the urine to form kidney stones. By reducing oxalate intake through dietary modifications and supplementation, individuals can lower their risk of developing kidney stones, which can lead to kidney damage and loss if left untreated. High levels of oxalate in the urine can contribute to the formation of kidney stones and may also directly damage kidney tissue over time. By limiting oxalate intake, individuals can reduce the burden on their kidneys and protect against oxalate-induced kidney damage. Number 8. Uremic toxins. Uremia is a condition characterized by the buildup of uremic toxins in the blood due to kidney dysfunction. These toxins can have harmful effects on various organs and systems in the body, including the kidneys. By managing uremic toxins through treatments like dialysis or kidney transplantation, individuals can prevent the progression of uremia and reduce the risk of kidney loss. Uremic toxins can cause symptoms such as fatigue, nausea, itching, and cognitive impairment, which can significantly impact quality of life. By managing uremic toxins, individuals can reduce these symptoms and improve their overall well-being. Number 9. Hydration. Adequate hydration is essential for maintaining optimal kidney function. The kidneys rely on sufficient fluid intake to help flush out toxins, waste products, and excess substances from the body through urine. By staying hydrated, individuals can support the kidney's natural detoxification process and reduce the risk of kidney damage. Proper hydration can help prevent the formation of kidney stones, which are crystallized deposits that can form in the kidneys or urinary tract. By diluting urine and increasing urine volume, adequate hydration can help prevent the buildup of substances like calcium, oxalate, and uric acid that contribute to kidney stone formation. Number 10. Vitamin D. Vitamin D plays a key role in regulating calcium and phosphorus levels in the body, which are essential for maintaining bone health and preventing mineral imbalances. In individuals with kidney disease, impaired kidney function can lead to disruptions in calcium and phosphorus metabolism. Vitamin D deficiency has been linked to an increased risk of cardiovascular disease, which is a leading cause of morbidity and mortality in patients with kidney disease. Cardiovascular complications, including heart disease and stroke, are common in individuals with kidney disease and contribute to kidney damage and loss.